Hello, everybody. I'd like to welcome everybody to my first podcast of 2021. On this January 1st, 2021, I'd like to wish everybody a happy new year. Hopefully, this year will be better than the last. I don't doubt it at all with the year that we just had. So let's just jump into it. In the last 9-10 months, media, government have been using fear to try to make us more docile and obey the measures and restrictions that the government put in place. And here I am not talking about the sanitary measures of social distancing, washing hands, wearing masks. I'm talking specifically about the lockdowns. So when this all started, this was a new virus. We didn't really know much about it, if at all. And so, understandably, the population was scared and really obeyed what the government was advising us to do. So, after a certain time, in these 9-10 months, we've learned more about the virus and about how to protect ourselves and the people we love. So in the last few months, since the second lockdown or the second wave, they are trying new ways to scare us, to instill fear in us, so we obey and become even more docile than we already are. So how did they do this? First of all, they changed the narrative from hospitalizations and deaths to new cases. So how did they do that? They went from testing 7,000 to 8,000, from doing 7,000 to 8,000 tests a day, to right now on an average of 35,000 tests a day. So obviously you're testing 4 or 5 times more people. You're bound to get more cases, especially using these PCR tests that even the founder and inventor of this test says shouldn't be used to track and trace the spread of Sars-CoV-2. And when that started not to work during this second lockdown, they introduced this new measure saying that hospitals will overload and we will be missing beds to receive patients. And finally, they instilled this new variant, which is, virologists agree, is perfectly normal in coronaviruses. Viruses adapt and they mutate. That's just how viruses work. So by trying to reconfigure this unknown so people get scared again. And also, obviously, hospitals, where they say are overloading, is definitely true. We have many less nurses in the system that have either quit or are absent because they're infected or going through some mental issues, whether it's depression or anxiety. So the system is in a hard spot. But I would just like to, in this podcast, or in this update, give you some statistics on the percentage and capacity of our hospitals in Quebec. So I made a few researches and I found some articles from December 2019, around let's say mid-December to end of December, and compare them to the same date 1 year later in 2020. So most of these percentages that I found are from December 22nd or December 24th. Getting into different newspapers. So some from Le Devoir, some from Journal de Montréal, some from the Gazette. And the numbers from December 31st, 2020 are directly from the site of l'Index de Santé, which gives us an up-to-date in real time of the capacity of hospitals. So in December 2019, the region of Montreal, on average, was at 108% of its capacity. On December 31st, 2020, that number goes down to 99%. In l'Estrie, which is the Sherbrooke area, in 2019, it was 110%. This year, as of yesterday, December 31st, it was at 76% capacity. The western part of Quebec, the Ottawa region, Gatineau region, was last year at 111% capacity. This year, 83%. Lanaudière region, which is Repentigny, Terrebonne, Joliette, was at 114% capacity. This year, 122% capacity. So that one went up a bit. In the South Shore Montérégie region, last year, in December 2019, was 129% capacity. This year, 119% capacity. In the Laurentians, which is up north, where Saint-Sauveur, Saint-Jérôme, Mont-Tremblant, etc., was at 135% at the same time last year. This year, 123%. So in these 6 regions of Quebec, only one region has seen an increase in lack of capacity in their region in the hospitals, which would be Lanaudière, with a jump of 8% compared to last year. Now, if we go more specifically into the city of Montreal, I have the data for 4 hospitals. I couldn't find data for Royal Vic. For last year, I couldn't find the data for Royal Vic, Notre Dame, Maisonneuve-Rosemont, Santa Cabrini, and le Centre Hospitalier, Université de Montréal, le CHUM, best known as le CHUM. So the 4 that I have the data for both last year and this year are the General Jewish, the St. Justin, St. Mary's, and the General Lakeshore. Well, the General Jewish last year in December was at 187% capacity. This year, 132% capacity. St. Justin, which was at 170% capacity, is this year at 19% capacity. So a decrease of 150% of its capacity in hospital beds. The St. Mary's, 127% capacity. Last year, 123% capacity this year. The General Lakeshore Hospital, with a capacity of 123% last year, decreases to 106% this year. So in these 4 pretty big hospitals in the Montreal region, all of them have seen a decrease in the lack of capacity in the hospital beds. If we talk in a more general matter, talking about Montreal, last year, on December 24th, 2019, 15 out of 21 hospitals had a high or very high percentage of capacity in their hospitals. So you're asking, how many this year? Well, this year, it's 13 out of 21 hospitals have either a high or very high percentage of capacity in their hospitals. So 2 less hospitals are either high or very high in capacity. So this clearly disrupts the narrative that hospitals are more overloaded this year than they were last year. Well, I know that the lack of health workers is definitely affecting the capacity of these hospitals. But is it really COVID to blame? I'm asking the question. Many studies say that the virus spreads more in the workplace, in factories, and in manufacturing, and at home are the places where the virus spreads the most. So once again, I ask, do lockdowns work? It deserves reflection. So guys, once again, thanks for listening. Wish you guys a happy 2021. And see you soon. Au revoir.